Hello everyone and welcome back to my channel. If you're new here, I'm Steph. I'm a mental health and cosmetic nurse, and today's video is about the nursing regulations that we as nurses, and more specifically cosmetic nurses, follow in Australia. Whether you're still in uni, interested in pursuing a cosmetic career, or if you're new to the industry and want to know exactly what's happening with the regulations and the standards that we have to follow, then take some notes and keep on watching. Just a little disclaimer, these are all based on my personal research and opinions. So if you're in a different state other than Victoria, make sure that you look at the regulations within your state, as it can change as well. AHPRA, what is it? So they're the Australian Health Practitioner Regulation Agency. It's a bit of a mouthful, so we'll keep referring to it as AHPRA. So they're an organization that makes sure that all of the registered doctors and nurses are qualified, properly trained, and are practicing safely. Their main focus is also protecting the public and keeping them away from harm. AHPRA also responds to complaints, and they also deal with concerns surrounding health, performance, and conduct of those who are providing care. AHPRA works with the national boards who have a clinical advisor, and together they influence and guide the standards and the principles, codes of conduct that we adhere to as registered practitioners. I think that most people who work as nurses or work within the healthcare field have a sense of passion and wanting to improve and provide care to other people. It's not exactly easy work. There's a lot of stress and physical, emotional, mental labor that comes with it. So it can definitely take a toll on someone. But if the work is rewarding and we generally are wanting to make a difference in someone's life, it can be a real rewarding job. So when you become registered, you basically automatically agree to adhere to all of the standards and principles that are set out for us to make sure that we practice safely and we are prioritizing the public's health and concerns. So AHPRA has listed 7 national standards, which I will pop up here. And all are interconnected and intertwined. And the reason for these standards is to guide our practices to make sure that we really are working within our scope of practice and prioritizing patient safety and outcomes. AHPRA and the national boards are important because they protect the public. They also help guide us in our practices to see what's within our scope and what is not. Their guidelines are also very helpful in developing policies, whether that's medical or local clinic policies, which we aim to implement in our daily practice. People seeking care can come from a place of vulnerability, and unfortunately, there are health practitioners who take advantage of that. Some of them have become unregistered because of the risks and the harm that they've caused to a lot of different people. Now, I can't comment too much on what has happened, but you probably have seen it on the news, and it's also in the AHPRA website here. Since there's ongoing investigations, there's not a lot of information I can say. Without regulatory bodies like AHPRA, it would fall on us, practitioners, doctors, nurses, to develop our own medical and ethical guidelines. That is a lot of pressure coming from a legal standpoint. Also, the lines of safety and improving your business can be easily blurred, potentially putting our patients at risk. The guidelines are also influenced by evidence-based practices, making sure that they use up-to-date clinical data to influence their decision around making these new changes and regulations. The cosmetic industry is still a young industry. It hasn't been around for a very, very long time. So these changes that come up are being navigated by AHPRA as well as us. So I think working together and having that priority of maintaining patient safety is the most crucial thing we can do to make sure that we're able to practice long-term and work in this field for as long as we can. So there's been a lot of changes in the last couple of years in terms of regulations, mainly around advertising cosmetic treatments. I was actually listening to this podcast episode from Inside Aesthetics. I love the podcast. I think it's very, very informational. You should check it out. And they had a guest speaker who actually worked with AHPRA. Now, they explained that they weren't from a medical background. They have been working in regulations and in that field for some time, but they made it clear that they weren't a doctor or a nurse or anything like that. So I think this brings the question of how much do these regulatory bodies actually understand about the cosmetic industry? If they themselves don't come from a job seeing the client and how the cosmetic field functions, how can they really decide what is safe and what is not. What the guest speaker did note is that they have a clinical advisory team who they consult with in navigating complications and notifications, complaints, but it's still unclear how much of those members are actually involved in the cosmetic industry. And the changes that they put forward can feel vague and also quite harsh. It also minimizes a lot of the hard work that a lot of cosmetic nurses put through, and these regulations may not reflect all the positive things that have resulted from these cosmetic treatments. It's easy to shine the light on the bad experiences, and rightfully so, since it puts the people's safety at risk, but we can't neglect all the good and positive outcomes that have come from cosmetic treatments done by those people who are really passionate and are safe and have dedicated their life to continue learning and sharing that knowledge with others. The main reason for these changes is to protect the public, and the changes can feel a bit vague. We as cosmetic nurses or cosmetic clinics cannot advertise treatments that allude to using medications, so that is technically your anti-wrinkle treatments, your volume restoration with filler. Anything that we script for is something that we can't advertise. We can't talk about our prices, we can't post before and afters, because if we post our before and afters, TGA states that we have to be upfront and honest and clear about what treatment has happened. But since we can't talk about the treatments, then we can't really post before and afters. So it's a bit of a double-edged sword for us. It makes it harder for the people seeking cosmetic treatments to know where to go, because people look at someone's work to see if they resonate with their values, with their aesthetics, and that process is now harder to find. People have to seek in-person or telehealth consultations, which I think is good to discuss the risks and side effects with the treatments that they may get. But again, with everything, most people will do the right thing, some people won't. We can't dictate what people do. What I have seen are forums online where they talk about doing their own injections at home, buying products overseas, which are quite risky. A lot of the adverse events reported with cosmetic injections are linked back to unregulated substances. What this means for us is we have to adapt our way of communicating our treatments and services to our clients. Again, if you have a real passion for aesthetics and the cosmetic industry, you would prioritize patient safety at all costs. So making sure that we stay within the regulations, within our scope of practice, and focusing on educating our clients, communicating what is going on in the industry so they can make a very informed decision. I think that AHPRA and the national boards have a real concern for the public safety. We as nurses and care providers must always prioritize that. I can acknowledge that it's very overwhelming with all the changes happening, a lot of uncertainty, a lot of unknowns. Change is difficult for anyone, especially in our industry where a lot of people work in this field as their own income. And with all the changes in the regulations on how we can advertise, it can certainly make and create an impact on those people's lives. But I think as nurses, we're quite adaptable and we're problem solvers, and it's all part of the job, and we've been doing this for years. So I think we'll be able to navigate it all if we just focus on the things that we can control and we can do. There you guys have it. That is all that I'm going to talk about today. There's so much more that I could say, but yes, AHPRA and the national boards prioritize patient safety, and they're also here to help us, not punish us. They want us to be able to work in this industry for a long time. And can you imagine having no nurses? I just can't even imagine that. But I'd love to hear your thoughts on these regulations. And if you live overseas, I'd be interested to know how different they are. Do you even have these regulations as well? And comment down below what you think. I am very keen to know. Thank you guys for watching today's video. Make sure you like, comment, and subscribe to my channel because there'll be more to come. But always remember that less is more. Thank you. Bye.